Nurses, this is the third critical care class at SSB Delhi. And as I always say that when you hear, you forget, you see, you remember, you do, I know. Today we are showcasing what should be there in the oxygen delivery box. For every class, for every vertical we finish, we will make a box. It will be a ready reckoner for all the nurses. Please refer to this box and let me introduce you on my right side, Julie, the nursing superintendent, myself, Dr. Bose, the medical director of SSB Delhi, Dr. Sanjeev Kumar, head of the Department of Intensive Care, SSB Delhi, and on the left we have Sister Nanthoy. She is the emergency head and nurse educator of SSB Delhi. So look, the effort which we are putting so that whenever you go through this video, you will come to know what should be there in a critical care oxygen delivery box. So I will ask Dr. Sanjeev to pick up and give it to here. Julie will put into the box and Antoy will note down and we will make a checklist. So once we are done with the box, we'll put up a checklist and that is called a standard operating procedure and that should be followed wherever we are practicing, whether in Faridabad or Delhi or our new hospital. This becomes our SOP for oxygen delivery system. So, Dr. Sanjeev, pick up the first thing.
Yeah, this is the endotracheal tube. It's a different size coming, 7.5, 8, 6.5.
This is, remember, you will be asked in your endotracheal tube.
So this ambu bag, this basically ambu bag is having 1 liter capacity. We have to make like 50%, 500 we have to give tidal volume, so not more too much, just a little bit.
This is basically an AMBU, artificial mechanical breathing apparatus. It has a rebreathing oxygenation. You can connect with the oxygenation. This is basically to put a certain volume of air into the lung.
This is the nasal prawn. We get
this is the most important thing. This we are using long oxygen pipe. Where do we need long oxygen pipe? Suppose you want to transport the patient to ICU, don't have an oxygenation system, and also for rehabilitation, pulmonary rehabilitation, those who are in chronic respiratory failure, you can connect the oxygen cylinder or the concentrator on one side, and the patient can walk, mobilize, or do activities on long oxygen pipe. This is for home rehabilitation.
Nasopharyngeal tube. This is a very important part.
This is a very important thing, nasopharyngeal airway. Many times what happens if you put a nasopharyngeal airway, it becomes easy to access the airway in a difficult intubation and also to improve the oxygenation to the system. And also it helps the person to breathe better.
And the Venturi mask is a very controlled way we can give oxygen.
So this is a Venturi mask. As we discussed, this gives a high flow system predicted. These are the Venturi works on the Bernoulli's principle. There are numbers here. Based on the percentage you want to give, this gives you the predictable oxygen delivery to the alveolar level. Only thing you have to adjust the flow. For every Venturi, there is a flow rate, which you have to refer the flow rate system, whether you're giving 10, 12, 14, and accordingly the percentage of oxygenation, you can move from 24 up to 60, 90%. This is a Venturi mask, and there will be different codes of Venturi mask, you must know.
And this is the reservoir mask with reservoir. It is like also is protected most and like certain amount of oxygen we have to.
This is basically when you have an hypoxic VQ mismatch, patient is hypoxic, not able to, you need certain oxygenation. In this bag, you can put extra oxygenation so that the oxygen delivery becomes more effective. The only problem is that if the patient has a high carbon dioxide, they start rebreathing carbon dioxide. With a normal carbon dioxide or no carbon dioxide and low oxygenation failure, this becomes very useful. Mask with
with
reservoir.
And this simple mask we are putting like 5 to 6 to 10 liter per minute.
This is a simple mask. As I told you, 1 liter gives you 4%, 2 liters gives you 8, 3 liters gives you 14, 12, then 4 liters gives you 16, and 5 liters gives you 20. And 6 liters gives you 24. Normally air has 21%, keep on adding 4 up to 6 liters you can give it. So that means 24 plus 21 up to 45% you can give through this is called low flow oxygenation system through mask.
And this is the circuit. That's the connector sort of.
Okay.
Yeah,
so this is what is this?
This is the
this is Bain circuit.
Bain circuits.
This is a Bain circuit. You know what happens through which you can do an AMBU, you can give oxygenation. This is a very useful to shift the patient from ER to HDU to ICU.
Yeah, yeah.
This is a Bain circuit, very useful.
This is the connector between the tube.
This is a connector. Without connector, many times you need different connectors. With oxygenation or the mask, these are connectors. Connector should have both the ends open.
And the nasal prong.
This is nasal prong. You see nasal prong. As I told you, nasal prong should be something like this. You should wear it in the nose and back in the ear. You understand? So I'll just show you. Put it like this, and lock it like this. This should be not like the other way around. So this is nasal prong, is a low flow system.
So once we are using NIV, this is the NIV mask. That's one the BiPAP mask.
This is the most important oxygenation. Sometimes what happens, patient in ERDS, in pulmonary edema, where oxygenation is very difficult, you have to ventilate the patient. You're not intubating in between. This is a BiPAP or a non-invasive ventilation. Through interface, you can give certain positive pressure ventilation. Inspiratory is called IPAP, expiratory is called EPAP. EPAP stands for expiratory positive airway pressure. IPAP stands for inspiratory positive air. IPAP and EPAP. This is a non-invasive ventilation mask.
This is the BiPAP mask.
This is a BiPAP mask. Non-invasive ventilation is normally with the ventilator. BiPAP machines are also available. Small, you have seen. Connect in the plug, you can give it anywhere. It can be given in the room, HDU, ICU, ER, and this is a bi-level mask. Bi-level is again principle of IPAP and EPAP. Inspiration is positive airway pressure, expiratory is also positive. It improves the ventilation. This typically given in COPD patient, obesity, hypoventilation, non-responding to oxygenation therapy. Also in LVF and pulmonary edema, BiPAP can be very useful. And also for chronic respiratory failure at home.
This is a connector again, both sides.
This is both sides connector. Connectors are very useful.
And the Megal airway, the Megal forceps.
This is, you tell me something about Megal.
So once you want to put the NGT, any type of, this is going to help you to put inside the like esophagus and stomach. It's very helpful.
This is basically whenever you are intubating the patient, it can sometimes the neck becomes stiff. They may have osteoarthritis when you have a stiff neck or a small neck or the neck fat. You're not able to intubate. This Megal is a very useful to hold it to put into the airway. So Megal is this is called Megal. You see, Megal forceps.
Also helping for NGT
even for Rives tube also insertion. For esophagus and airway, both it is useful.
Yeah, and now we have like the laryngoscope. Two different type of laryngoscope. This is the Macintosh, and another is having like Miller.
Sure.
So this is what we are using.
Can you assemble and show?
Yeah, that's right. This is the way you have to keep in this way, and the light will be here. Just put there, and that will be like this.
And
so it is very easy.
And also you tell the students what is the posture of the head.
Yes.
Chin lift, head tilt.
Yeah. So and the extended form, chin lift and head.
Chin lift, head tilt.
Yeah. So this
is chin lift. And also tell how you hold the neck.
So it should be with like two finger and one finger will be there with ambu back sort of like this way. You have to.
So chin lift, head tilt. You with one hand here to
and
lift the chin. Chin lift, head tilt. Chin lift, head tilt.
Yes. This is the way you have to.
This is for adult.
Yeah, this is the adult 4. 3 we have, different with 2. So this is the Macintosh. This is the Macintosh. Another we are Miller as well for PDS.
What are these? These are pediatric sizes?
No, this is the adult size.
The adult size?
Yes, it's 3, it's 4 and 2. So this is the laryngoscope. Very important. This is a filter. Once you connect with the ventilator, this is a filter connector sort of thing.
This is filter, bacterial filter, because airway is a big source of bacterial infection. This is a bacterial filter, should be changed.
And this is bougie. Different size bougie we have. So this.
What is the purpose of bougie?
Bougie, once it is sometimes difficult intubations, you cannot very like
so
anterior.
This is basically you put in endotracheal, you can guide.
Right.
It's for difficult intubation.
So we are using bougie. And that one is having a disposable water tap circuit. So we are using for connect the ventilator.
This is disposable. One for breathing in, one for breathing out.
Water trap.
This is called disposable double lumen
water trap
system.
And That one also to tie the tube. We are using this way.
This is tying the tube, endotracheal tube.
Yeah. And jelly very
This is
important.
jelly is very important because jelly is very important because and
So will you
it
click
is
and
it's called lignocaine jelly because lignocaine is a local anesthetic plus it's lubricant so that it doesn't hurt the airway. So it's lubricant.
and again that
What is
one
this?
is this is the with ventilator and with like a tube.
This is a connector,
With
and through this pore you can, insert the suction catheter for effective suction.
Propor.
This is mic very important because this all should be handy.
Again, this is an stylet. This is, once you make the intubation, make it easy for us.
For easy intubation, stylet. What is
And
this?
for BiPAP connector, like support itself.
This is called headgear for BiPAP because if the most important in non-invasive is the headgear. So it should be your Velcro should be fine. You should all check these Velcros.
And Caesar.
And this is the most important thing because Caesar will be very useful. Don't run around for the Caesar. This is so, friends. Just give me that. This is one thing,
It's
and
ready.
tear out the page. Tear out.
So this is a checklist. What before leaving anywhere we have to
So
see.
this is the checklist we have made. We have put in the box. So you have learned. This is the right way of learning. So checklist in the box. And today we have done the airway oxygen delivery system. So whenever we finish the course at the end of the 3 months, this box will be asked to you.
Yeah.
Okay? Thank you.